Stroke, depression, and inflammation. What's the connection? I'm Dr. Jim. I've been looking into the issue of inflammation, not just joints, arthritic types, but we're talking cellular levels of inflammation. And I've been reading phenomenal articles out of chemistry journals, biology journals, genetic journals, and getting a lot of headaches. But because I'm no chemist, I'm no biologist, I'm just a simple gerontologist. But this is something that really deeply fascinates me. So stroke is definitely a leading cause of death in the United States. We know that. It's also a leading cause of death around the entire world. 1 out of every cardiovascular disease-related death is due to stroke. Okay? Depression is most likely to occur after a stroke, and not only because of the emotional reactions or the psychological impact. I'm sad and I'm depressed because I had a stroke. I might have anxiety about having another stroke. But rather, we're talking about neuroinflammatory processes that occur during and after a stroke. Neuroinflammation within the cell, okay, at the neurological level. Post-stroke depression is usually associated with poor recovery and quality of life. So this is important. Having a stroke can be anywhere from mild to devastating. It's scary. People worry about having another one, so on and so forth. But some can really just impact a person's quality of life completely and in very terrible ways. So what is post-stroke depression? First of all, it's more common than we once thought. That's a big takeaway from today's topic. Although depression after a stroke is common, it many times goes unrecognized and therefore untreated. It's estimated that over 33% of stroke survivors experience symptoms of depression. People who have post-stroke depression have poorer neurological outcomes and greater financial costs. Recovering a stroke while dealing with depression may be affected by a number of factors, like the person's age when they had the stroke, severity of the stroke, the location in the brain where the stroke actually took place, and of course, health, functional, cognitive status. All of those things are very, very important, as are genetics, inflammation, nervous tissue damage, disturbance of neural networks, and changes in neurotransmitters. And that's the stuff that kind of gets me all psyched up to continue studying. I know I'm a nerd. Okay, post-stroke depression and inflammation. What's the connection here? For some time now, researchers have identified inflammatory markers associated with depression. Inflammatory markers associated with depression. People with depression, for example, have an increase in pro-inflammatory cytokines, which enter the brain and influence neurotransmitters involved in depression, just like in the serotonin system. There may also be an increase in interleukin 6. What is that? It's a chemical that causes inflammation, leading to depression, though through its impact on the HPA axis, which is the bundle of nerves running down right in the center of both hemispheres of the brain, and that interferes with metabolism of neurotransmitters. Okay, what can help? Certain antidepressants obviously can help, and physicians, psychiatrists, so on and so forth would probably go to certain antidepressants first, like the SSRIs, selective serotonin reuptake inhibitors, like Celexa, Prozac, Paxil, Zoloft, right? They all work to restore a balance of serotonin, which is disrupted by inflammatory processes. The other types of antidepressants are the SNRIs, selective norepinephrine reuptake inhibitors, like Savella. And these are newer. These are one of the newest. I know they are the newest line of antidepressants. What about vitamins? Let's go off the rails. Let's move away from medication and talk about natural things. Besides antidepressants and, of course, some form of psychotherapy or counseling, which I always recommend, certain vitamins might be helpful in managing post stroke depression. I think I could write a whole article on this, as a matter of fact. Anyway, B stands for brain. Vitamin B12, vitamin B6, and folate. What do? They break down homocysteine, which is a naturally occurring amino acid and is harmless when it's in very low levels. At high levels, on the other hand, it can do a lot of cardiovascular damage. I just read, I'm reading, I was into deep reading a new book last night called Cheating Death or something like that, how like the newest of the new science is really getting down into the cellular level and reversing aging and cheating death and so on and so forth. The author highly recommends taking a good vitamin B complex. Low levels of vitamin D have been shown to be a risk factor for post-stroke depression and is generally recommended after a stroke has already occurred. It provides neuroprotection. Vitamin D, we get it from the sun. Neuroprotection. How? It reduces oxidative stress, which are free radicals, and inflammation. Okay, retinoic acid, a metabolite of vitamin A, acts like vitamin D in reducing oxidative stress and inflammation. There you have it, short and sweet, just something that's on my mind, something that I've been researching for some time now. Inflammation, but in particular, stroke, depression, and inflammation. There you have it. Keep coming back for more information, and I hope to see you soon. Thank you so much for taking some time to watch the video. I appreciate it. And if you're a licensed healthcare professional who's looking for some great continuing education, we've got it. And we are always working on brand new, fresh content for you. So you can find the link to the website in the description and keep coming back for more information. I hope to see you soon.